out too while you are going through this. I want to thank everyone for joining us. My name is Melissa Unger, and I am the Executive Director of Seiu Local 503. And I'd like to thank Senator Merkley, Congresswoman Bonamici, and Governor Brown for making time to join us today. I'd also like to thank just all the frontline workers we have right now in healthcare, public safety, and other essential leaders, and union leaders and employers, because this is a really busy time, but we're talking about a really important subject. We're here today to call on the Trump administration and the federal government to make health and safety of our frontline workers in Oregon a top priority by making PPE available now. 2 weeks into the drastic measures around social distancing that we're in, Oregonians are counting on our essential workers, and that includes hospital workers, grocery store workers, frontline government workers, and those providing long-term care to some of the most vulnerable and at-risk Oregonians. It's important that when we talk about PPE, we're talking about all of the people who need it. These workers are facing serious risk of exposure to the coronavirus every day, and they deserve protection. And they're performing essential work, and they deserve essential safety equipment, and that is PPE. So we have a lot of different speakers today, elected officials, workers, union officials, and employers. We hope that you'll stay with us throughout the press conference because the stories and solutions are important. After our speakers finish, we'll open it up to questions. If you have a question, feel free to raise your hand by clicking on the participants at the bottom of your screen, and then clicking on raise your hand in the lower right-hand corner. If you're on the phone, you can dial *9 to raise your hand, and we'll unmute you so you can ask questions. Make sure that if you can, when you ask a question, please identify who your question is for. Once again, if you're having challenges with the Zoom system, feel free to, Courtney G is somebody you can privately chat, and she can help you. We're going to begin with Oregon Governor Kate Brown. Governor, if you're speaking, we cannot hear you right now.
There, can you hear me now?
Yep, yeah, I can hear you now.
All right.
Go ahead.
Well, good morning. Thank you all so much for having me, and thank you, Melissa, for coordinating this. This is my first Zoom conference, and we are certainly living in unusual times. And I'm honored to stand, albeit virtually, with so many amazing Oregonians. We are certainly all feeling the impact of the ongoing public health crisis of COVID-19. And I want to start out this morning by thanking the incredible individuals who are showing up every day to do their jobs, to keep our state healthy and to keep it operating, frankly, to save lives. That's our nurses, our doctors, our firefighters and first responders, and our healthcare workers. We also can't underestimate the critical contributions of our home care providers, custodial and maintenance workers, truck drivers, and grocery store employees. Thank you, each and every one of you. As your governor, I'm doing everything I can to slow the spread of the pandemic. You have my commitment that I will continue to fight and advocate for essential personnel to have the protections you deserve. And that's why we recently launched an education campaign to encourage Oregonians to stay home and save lives. It highlights the essential workers on the front lines of this crisis who are working every single day to ensure Oregon continues to operate. There's one key takeaway message from the campaign: stay home. Let me say it again, stay home, so you can protect our everyday heroes. We have to do more though. My biggest concern right now is personal protective equipment, or PPE. It's absolutely unacceptable that healthcare and home care workers lack the necessary resources to protect themselves and their patients. That's why I've directed healthcare providers to pause all non-emergency procedures. I've also asked for any individuals, businesses, and organizations with reserves of PPE to donate them to the COVID-19 response effort. My administration is also pursuing all available options to secure more PPE, but we need the federal government to step up. It's been really alarming and heartbreaking to hear the stories on the front lines of people reusing face masks and not having adequate supplies. I am not exaggerating when I say this outrageous lack of action will result in lost lives. including those of our healthcare workers and our home care workers. But I will continue to work with Oregon's congressional delegation to fight for frontline workers and fight for more PPE in Oregon. Most of us have never gone through anything like this. And although each of us may have a different experience right now, one thing continues to connect us. We all love Oregon and we all love our communities. And I know that Oregonians come together in times of crisis. I've been blown away by creativity and generosity. Many Oregonians are helping their neighbors, coworkers, and some of our state's most vulnerable people. Your giving spirit and selfish actions make me proud to be your governor. I just want to end by saying, I know these times are incredibly difficult. I want you to know that I'm doing everything in my power to fight for you, for more PPE, and to help our Oregonians stay healthy and safe, to make sure we can all get back to normal as soon as possible. But in the meantime, I want to remind everybody to stay home. Thank you all. Keep up the great work.
Thank you, Governor, for joining us. I'm now going to have Irene Hunt, who's a home care worker from Springfield, Oregon, and a member of SEIU 503, talk about people.
Thank you, Melissa. Thank you, Governor. My name is Irene Hunt, and I am a home care worker based out of Springfield, Oregon, and a proud SEIU 503 member. As a home care professional, I'm considered an essential worker, and I'm still required to continue going to work each day. For me, that means going to my consumers' homes and providing assistance necessary for their survival. Many of our consumers are medically fragile and extremely vulnerable to the coronavirus. The same can be said for many home care providers and our families. We're immune compromised, and contracting the virus could be fatal for us and our loved ones. But we have a responsibility to care for our consumers, and for many of them, we are their only support. I want to be able to provide care for my consumers now when it's needed the most. Unfortunately, I have no PPEs. None. Home care providers are frontline healthcare workers, and we have no equipment to protect ourselves. We can't even go to the store and buy a mask or gloves with our own money because the shelves are empty. This puts our health, our patients, health of our families, health, and the health of our entire community in jeopardy. For my consumers, my family, me, and all of us, please provide home care workers with basic safety equipment necessary to continue doing our jobs. If our work is essential, our health and safety should be too. I am a mother, and as of Monday, because I do not have any PPEs and worried that I could possibly pass this to my daughter. My daughter is being watched by my mother-in-law, who is 70 years old. I had to drop my daughter off Monday, and I have not been able to pick her back up to make sure that they stay safe because I'm afraid. This is my daughter, and I'm choosing to continue to try to take care of my clients and to keep my job. And I just really need this to be over, and I need PPEs so that I can protect my family. Thank you.
Thank you, Irene, for sharing your story. Those stories are so important. I now am going to turn to Alicia Holohan, who's an emergency department technician at Sacred Heart and a member of SEIU Local 49.
Good morning. As Melissa just stated, my name is Alicia Houlihan, and I am an emergency department technician, Riverbend Hospital, Springfield, Oregon. I'm a local SEIU 49 member, proud to be. So, wow. So I have been on the front lines of this healthcare crisis since it has begun. This means that we have worked to put procedures into place to both protect patients and ourselves. When somebody pulls into the ED, comes into the lobby, and they present themselves with the virus, they come in for triage. And we have to make decisions at that time how to best provide care while maintaining proper safety procedures. While some of the patients are too sick and get admitted to the critical unit, others are lucky enough to go home and be self-quarantined. We are all currently working 12-hour shifts, and we are asked to only use one surgical mask per shift. Last week, we were just approved to use cloth mask, and that is not acceptable. As we see, we need this essential equipment to be able to handle the surge and anticipate all the people that are going to be coming in. We need to have more PPE. We need to have other equipment. We need more ventilators. We don't need to be putting 2 people on 1 ventilators. Every time I leave home, I have to say goodbye to my family, not knowing when I'll see them again. We don't know what each day holds for us. We might at any point be mandated to stay at that hospital. But I feel it is my responsibility as a healthcare professional to show up and care for patients and my coworkers, and to accept the risks that come with the job. If I could say one thing, I want to say the same thing that Governor Kate Brown said. Please, everybody, do your part. Stay home. That way we can protect our patients and ourselves.
Thank you, Alicia, very much. We're now going to turn to Casey Parr, who's a respiratory therapist at OHSU and an ASPE member.
Thank you, Melissa. Yes, my name is Casey Parr, and I am a respiratory therapist at OHSU, and I'm also a board member for ASPE Local 328. As other people have outlined, healthcare professionals like myself are working in conditions right now that put our lives and the lives of our family on the line. Irene's story was really touching to me because I also have a young child at home. I have a 2.5-month-old infant. And I'm also living with my mother-in-law, who is in her late 60s and at higher risk. I'm 35 years old, and for the first time in my life, I've considered whether or not I need to write a will. I'm already anticipating that I will likely be infected because I lack basic protective equipment. When I'm treating a patient with COVID-19, I'm concerned about coronavirus traveling in both droplet and airborne form. Many of the medical procedures I perform as a respiratory therapist on a daily basis aerosolize the virus. And we know that coronavirus can live on surfaces for many, many days, and it can live in the air for several hours. Due to lack of personal protective equipment, healthcare providers around the country are being asked to use masks for an entire shift, sometimes up to a week. And these masks are meant to be used once per patient encounter. The repeated handling of these masks increases my exposure, increases my risk of infection and transmission to others, including my patients that don't have COVID-19. And while my colleagues and I have been lucky so far, we have no doubt that one of us is going to fall ill very soon. But despite all of this, we show up to work every day because we took an oath to provide the best care possible. But when our healthcare professionals become patients themselves, it's going to limit the number of staff that can continue that care. And with the surge of COVID-19 cases still on the horizon, we really feel like we're running out of time. So we need your help.
Thank you, Casey. And I think it's important that, we're talking about hospital workers, we're talking about long-term care workers, but we know that there's many other workers who continue to need PPE as well. And so I'm going to turn it over to Melody Gramley, who is a East Salem Fred Meyer employee and a member of USCW Local.
Thank you, Melissa. My name is Melody Gramley. I serve on the executive board with United Food and Commercial Workers Local 555. My coworkers and I stand face the COVID-19 on a daily basis. While the White House waivers, grocery workers and healthcare professionals are getting infected with COVID-19 and in turn are infecting the communities across this nation. We need access to personal protective equipment and priority testing. It isn't just important for us to, but it is also imperative for our community. Your trip to the grocery store should be safe and cannot be safe without second step priority testing for grocery workers. Any employee who deals with the public is essential and deserves to be protected. Anything that protects essential workers will also protect us and the community. Today, I ask that all politicians at both the federal and local level take more decisive action to protection both healthcare and retail employees during this global pandemic, and to release both reserved and seized masks, as well as other protective equipment to workers like us, so that we can be part of the effort to help slow the spread of this virus to ourselves and to our communities. Protecting retail workers protects the community and protects the healthcare professionals. We can no longer pretend we are disconnected. We're all in this together.
Thank you, Melody.
Thank you.
I'm now going to turn it over to Sarah Laslett, the Executive Director of the Oregon Nurses Association.
Good morning, everybody, and thank you for bringing together these amazing stories. They are just so important. As Melissa said, I am Sarah Laslett, the Executive Director of the Oregon Nurses Association. We represent more than 15,000 Oregon nurses and allied healthcare workers across the state who are currently at the bedside providing care under these difficult conditions. And the stories that we are hearing from nurses are absolutely appalling. In some facilities, protective equipment has already run out. In Portland, we're seeing emergency room nurses wearing swim goggles because there are no more medical face shields. On the coast, they are storing their dirty masks in paper bags and Rubbermaid containers to reuse again. And in Central Oregon right now, some of our nurses have been wearing the same N95 mask for 3 weeks straight. These nurses and the allied health workers that you are hearing from this morning, we are the people that are running towards the fire to help others. And right now we're getting burned. We already have several members in ONA who have contracted COVID-19. We have a number more who are in quarantine and presumed to be infected. Without the proper safety equipment, these frontline workers, they will continue to get sick. And as Casey already said this morning, if those frontline healthcare workers aren't protected, they will not be able to do the healthcare that the public desperately needs as we approach the surge here in Oregon. It is also essential that frontline workers, nurses, and others need to be protected after they get sick. And this includes access to coronavirus testing. It includes paid sick time. It includes job protections for workers who go under quarantine. There are so many issues that we need help with. We need the federal government to stand up and to release the strategic stores. We need our employers and our local electeds to work with us, and I appreciate those that are on the call this morning to speak with us in one voice. The storm is coming. We have to act now. Thank you.
Thank you, Sarah. And before I turn it over to the next speaker, I do just want to highlight, we had a child welfare worker who was going to join us this morning too, but they were not able to. And the other group of workers that are really on the front lines in this crisis are frontline government workers, including people in 24-hour facilities like corrections in the Oregon State Hospital, and child welfare workers. And so one of the goals of this is to just say that this crisis needs big solutions because it is impacting so many people. So I'm now going to turn it over to Rick Miller, the CEO of
Hi, Melissa. Can you hear me okay? Can you hear me? Okay. Hi, I just want to reiterate some of the things that have already been said today, and that is that our nursing and assisted living facilities and home care agencies are in crisis. we're experiencing critical shortages of personal protective equipment, particularly in Washington and Oregon. Our normal supply channels have failed to keep up with our demand, and we've asked for help. But unfortunately, we, like many, feel alone in this fight. We're forced to solve this problem on our own, and we're failing. We've reached out to suppliers from all around the world, so it's not a lack of effort in trying here, but we've had a little success. What we have found is that where we can find supplies, the prices have skyrocketed, Melissa. The price of surgical masks are up 20 to 40 times what they were 3 weeks ago, 20 to 40 times. N95 masks are up 5 to 10 times now, and gloves are up 3 to 5 times what they were just a few weeks ago. On top of that, the suppliers, the ones that will return our calls, are asking, these international suppliers are asking for deposits in the neighborhood of 50 to 100% of the order. And we have a sense in some cases that we're not going to receive those supplies or a refund of the deposits from some of those vendors, but we're trying. We also are experiencing where we have found minimal supplies that we have extended delivery times, that when these supplies reach the U.S., they're getting stuck in U.S. Customs. And we're also being told, interestingly enough, that sometimes we're actually bidding against the U.S. government for these supplies, and obviously we can't compete with the U.S. government. As a result, all of our locations, like we've heard here earlier, were critically low. We've resorted to using volunteer staff and family-made PPE alternatives, things like what we're doing. We have cloth bandanas for masks. We've got ponchos and large men's shirts for gowns. And while we greatly appreciate all these efforts, these products are obviously inferior in quality and effectiveness. Our workforce, as we're hearing today, is frustrated. They're worried. They're worried for their own safety and the safety of those people that they care for. And I also say that we are not accepting admissions in many locations as a result of not having adequate protective equipment. I'll just finish up by saying this: we need help. We shouldn't be forced to choose between hospitals and nursing and assisted living communities and home care. We just need to make sure that enough supplies are being produced and available for everyone who needs it. Thank you.
Thank you, Rick. I'm now going to turn it over to Dr. Danny Jacobs, the president of OHSU.
Good morning. Thank you, Ms. Unger. Pleased to be here this morning on a sad occasion, as you've heard from the other speakers. At our health system, as I believe is true for every health system in Oregon, people are our highest priority. They're laser focused on the safety and well-being of our members and our patients. As I say, we must take best care of ourselves so we can best care for others. As COVID-19 unfolds nationwide, OHSU and other systems are doing what we can to prepare for case scenarios. But to be successful, we must have the resources needed to care for those in our communities. Available personal protective equipment like gowns, masks, and face shields, as you've heard from the other speakers, are already strained or woefully insufficient. And the current supply chain is not sufficient to meet what I think will happen as we reach surges around among critically ill patients, perhaps in the next several weeks. So this is extremely concerning, and it will have life or death consequences unless they are addressed. Again, as you heard, under normal circumstances where when health systems or others order supplies, the vendors guarantee delivery. We know when shipments are coming, and we can often increase the size of our orders. That is no longer the case. At this time, we no guarantee, we often don't even know shipments are going to arrive. Unfortunately, this means that health systems and care personnel and other essential workers are being forced to implement personal protective equipment. For example, at OHSU, with the governor's guidance and leadership, we have stopped all non-urgent medical appointments, and we've canceled all non-urgent invasive elective operations or other procedures to preserve supplies. We've taken other steps that are too numerous, I think, to be mentioned here. Fundamentally, it is terrible that healthcare personnel and other frontline workers are in this position, but without proper supplies, we have no choices. Again, as you have heard, the shortages of personal protective equipment is placing even more stress on the very people who are providing essential services to try to save lives. Our workforce needs more, and I think the people of Oregon deserve better. So we are looking in every nook and corner, again, with support from the state, trying to identify where supplies exist that can be redistributed based on need, including veterinary offices, dental clinics, and other places. Local businesses are also stepping in to manufacture products for us, but we fear that it still won't be enough. So we also would like to stand with you all to ask and implore the federal government to do more, to do everything in their power immediately to help us save lives by producing and distributing adequate personal protective equipment for the impending surge in COVID-19 cases. Thank you very much.
Thank you, Dr. Jacobs. And as I turn it over to Congresswoman Bonamici, I just want to add to the message that the employees were saying is that employers are spending critical time that they need to be focusing on this crisis and for all the different patients, and they're having to track down their own PPE, and that is not what we want people spending their time on. We want them spending their time on the care of patients and their frontline staff. And so I'm now going to turn it.
Can you hear me?
Yep, we can hear you.
Okay, terrific. Thank you so much to Melissa and SEIU for organizing the conference, but really the thanks go to Irene and Alicia, Casey, Melody. Thank you so much for sharing your stories, which are devastating and heartbreaking, and a lot like other stories that I've heard over the last several days from people who are there on the front lines. And as Sarah from the Oregon Nurses Association said, running toward the fire and getting burned. And it is absolutely unacceptable here in Oregon and in the United States of America that people are having to do what we've heard about today, making masks, using old clothing. That's unacceptable and it's dangerous. And I know that I speak for many of my colleagues as well that say, we won't stand for it. We're going to do everything we can to get personal protective equipment here to our frontline healthcare workers and the frontline essential workers who are keeping things going in our communities. And yes, Governor, we're all going to stay home as much as we can, but these healthcare providers and essential workers, they can't. They're essential. They're important to the health of our communities. And so I've been hearing concerns over the past several days, and I know, I understand, I hear you. You need this personal protective equipment. Rick Miller talked about the price gouging and the barriers that are being put in place. And I know you're going to hear from Senator Merkley as well. We're going to do everything we can to fight those barriers. I've been on the phone, including over the weekend, in the evening with officials from Health and Human Services at the federal level, trying to track down more of the PPE from the national stockpile. We've received some, but we know it's nowhere near what we need. If we had what we needed, we wouldn't be hearing the stories we're hearing today. I know we're getting donations. I know the governor put out a press release saying the Oregon Dental Association and others are donating. Still, just a fraction of what we need. We're also hearing from businesses across the region here and in Oregon. They want to help. They want to help manufacture more PPE right here at home. And we're working on making sure, I led a letter to the Secretary Azar, let's break down the barriers. We don't want these manufacturers starting to make the equipment and then hearing, well, we can't use this equipment for whatever reason. We're trying to expedite that process for them so we can start making more PPE right here in Oregon, giving them that clear guidance that they need to get this PPE out to the frontline workers right as well. So we haven't heard a full response from the administration yet, but we're going to keep pushing on that so that we can start that manufacturing, ramp up what's being done. A lot of local companies want to help. A lot of people want to donate, but we still need to keep pushing and pushing for what's in that national stockpile, for every bit of personal protective equipment to get into the hands. There's no reason why any piece of PPE should be sitting in a closet or a stockpile right now. It needs to get on the hands and faces and bodies of people who are saving lives. So we just passed on Friday, the House passed the CARES Act, which had already passed the Senate. It does include funding to purchase PPE, but again, as we heard today, there's still a lot of barriers in the way. So caregivers and those on the front lines, thank you. I know you're taking time to share these stories, time that could be spent saving lives, but again, you're putting your lives on the front line every day. You shouldn't have to do that in a way that's not safe for you. And please know that we're going to do everything we can to turn this around as quickly as possible and get that protective gear in your hands as soon as we can. Lives are on the line, and as we know, we're continuing as we have more testing and more people at risk. We're continuing to increase the need. So we're going to keep fighting. We're going to keep pushing. And again, thank you to everyone who shared your stories today. We can't save lives without you. Now I think we're turning it over to my friend and colleague, Senator Merkley, who's also on the front lines of this fight to get the PPE you need. Thank you.
Thank you, Congresswoman. And yes, we are. Senator Merkley.
Greetings, everyone, and thank you for joining in this conversation designed to draw attention to the enormous shortage of protective equipment. And those stories of all of you who are on the front line, Irene, Alicia, Casey, Melody, thank you so much. My wife is a nurse, a hospice nurse, and so we're experiencing firsthand the challenge of this PPE shortage. You know, our healthcare workers are in particular danger. You may have read about around the world how many healthcare workers are getting sick who are younger. And I was reading yesterday that part of the reason is that the amount of viral loading that you get greatly increases your risk. So you get a little bit, you may get the disease, but at a lighter level, and younger people tend to have stronger immune systems and so forth. But if you get a lot of exposure, it can overwhelm your immune system before it can catch up. So this is why it's particularly important of all of our frontline people to have protective equipment. And here in Oregon, just 2 weeks ago, we were averaging under 10 cases per day. Now we're averaging over 60 cases a day. So what will we be in 2 weeks? We don't know. We hope that the social distancing has had a powerful effect on the growth of the disease, but we're preparing for the possible continued escalation. The CARES Act that Suzanne mentioned has $16 billion for the Assistant Secretary for Preparedness and Response to buy PPE for healthcare workers. Okay, well, having the money is fine, but you can't buy what doesn't exist. And that is where the production side has been enormously challenging. And so the quickest way to ramp up production of this life-saving equipment is for President Trump to use the power that he has under the Defense Production Act to get companies quickly in gear to produce the PPE. It's why I joined with several of my colleagues in calling on Trump to use this authority under the Defense Production Act to boost production. It's why I joined Tammy Baldwin in launching a bill that would immediately require a purchase through the Defense Production Act of 300 million N95 masks. It's why I've been calling the head of the strategic stockpile to say, we need another shipment to Oregon. And then when those shipments get lost, why I've been calling to say, where is that lost shipment? And almost like guiding it into the warehouse when the trucks are don't know where they're supposed to go. We are in an extraordinary time where we're being hit both by the healthcare emergency and certainly by the economic implosion. But we're also under essentially an epidemic of anxiety because this is new. We haven't been through this before. And because we haven't seen the federal government respond to catch up, if you will, or get ahead. Testing, very slow for the federal government to produce test kits. Protective equipment, we've all been talking about how slow the president's team was to gear this up. Certainly in terms of social distancing, mixed messages from the top. We're going to get through this. We've seen other nations start to get through it and see the cases start to decrease. But the way that we absolutely minimize the number of people who are affected is through really fierce social distancing and through production and availability to everyone who is a frontline worker and is facing exposure. So I'm dedicating all my efforts to that. I really appreciate you all doing so much to draw attention to it. And we just have to keep pushing and working. And Rick, I wanted to mention, if you're still on the phone, when you noted that some shipments have been trapped in the import challenges, let me know the details and I'll follow up on that, because we want to get everything. We don't want anything trapped in import commerce checking it out. So thank you all. I'll turn this back over to Melissa.
I got to unmute myself. Thank you. Thank you, Senator. Thank you, everyone, for sharing your stories. This is just such an important issue, and that's why we wanted to pull this together. It's a reminder that the need for PPE is for hospital workers on the front lines. It's also for long-term care, home care, and facility workers in long-term care, grocery store workers, and frontline government workers like child welfare and 24-hour facilities like corrections and state hospital. And the reality is, because the list of people who need this is so broad, we need big solutions. And as we heard, employers are doing all they can, and we need the federal government to step up and help us in this moment. So one of the, we're gonna actually move to questions, and if you've ever done a Zoom press conference, well, nice work, I haven't, so let's see how this goes. But this is what we're gonna ask folks to do if you have a question. You can raise your hand by clicking on participants at the bottom of your screen, and then clicking raise hand in the lower right-hand corner. We'll unmute you in order to ask your question. Please, if you have a question for a specific person, ask the question towards that specific person. It'll be very helpful to be able to make sure that we can find them by having you ask for a specific person. So I see someone who has raised their hand. Unfortunately, I don't know their name, but oh, there's tons of people who have raised their hand. So I'm gonna try this first with Kale Williams from the Oregonian. Go ahead, I think we're unmuting you. Go ahead, Kale. Kale, I can't hear you if you're speaking, but you are unmuted. Okay, Kale, I can't hear you. So this is going really, so far, so good on the first question. But so I'm going to ask one more to Courtney Graham, who's at the bottom. She just chatted. Said a reminder, if you have tech questions or issues, you can privately chat her, and she's going to help you. We're going to go to somebody else to see if it can work right, work better. So Hannah from Coin6.
Oh, can you hear me now?
Yep, we can hear you.
Excellent. Good morning, and thank you for taking my question. This question is specifically for Governor Brown. I've been hearing from people in the death care industry, specifically funeral homes, crematories, mortuary transport services, that they are also facing shortages of PPE. How does the state plan to address their concerns, and are there any plans to name them specifically as essential workers or frontline workers?
Thank you. Thank you, Hannah, for that question. We know that our capacity in the death care industry will be strained, and we are watching and tracking those numbers very carefully. We don't have the designation of essential, non-essential workers here in Oregon, but I am focused on getting as much personal protective equipment for folks who are on the front lines, and I would certainly include these folks in that arena. Here's the issue. We've gotten somewhere in the neighborhood of a quarter to about 40% of our requests from the federal government. They're coming in slowly, and as Senator Merkley mentioned, sometimes we literally are guiding trucks from the feds making sure they get into the right gates at the right time when folks are available to unload the equipment. But here's the reality. The president could apply the Defense Production Act and require industries, manufacturers across the country to make personal protective equipment. Despite repeated phone calls to the Vice President and other folks in the federal administration, for whatever reason, the President is not making that call. So there are 3 companies in the United States that I'm aware of that have patents on, for example, N95 masks. It's DuPont, it's 3M, and it's Honeywell. Someone is choosing to protect these patents as opposed to protect the lives of Americans. So in Oregon, what we're doing is we're working with local manufacturers to produce the PPE that we need. It's obviously going to take some time to ramp up. Barry Leslie is my PPE czar, and we're working on that. We've been working on that for several days now, close to a couple weeks now. So we're going to have to make our own equipment, but it would be, frankly, much more accessible if the President were to approve the use of the Defense Production Act, and we were able to get FDA-approved specs to make PPE, gloves, masks, and gowns.
Thank you, Governor. I'm now going to call on Andrew from the Associated Press.
Okay, I think I just got unmuted. So, if you could hear me, this question is for Sarah Laslett and Danny Jacobs. And I heard that in one hospital out of Oregon, but somewhere in the United States, that 4 ICU nurses quit in one single week because the situation is just so atrocious with lack of the PPE. So I wanted to check to see with Danny and Sarah if you have heard or know of healthcare workers that are leaving because the situation has gotten so bad. Thank you.
Was the question about healthcare workers leaving positions?
Healthcare workers, the frontline healthcare workers, if any are quitting because it's gotten so bad. ICU nurses, respiratory therapists, nurse practitioners, nurses, etc.
We are not aware of nurses or any frontline healthcare workers leaving their positions. In fact, I think you heard earlier, people are stepping up and they are taking the additional shifts and they are figuring out ways to protect themselves on the job, even when the medically approved equipment is not being made available to them. We see a tremendous level of commitment from RNs and other frontline healthcare workers, and we are not aware of anybody stepping back from the challenge that they are being faced with.
That would be my experience, our experience at OHSU as well, is that actually people are, what was the expression, running towards the challenge earlier. In fact, the level of volunteerism as well as dedication to patient care has been extraordinary. So we've not seen anyone ever step away from the challenge.
Thank you both.
I'm going to go ahead and call on Claire. Can you go ahead and ask your question?
Yes. Hi, everyone. I had a question. I don't know if maybe Irene or Alicia could answer this, but I'm wondering what type of protective gear that you're lacking and what would be most helpful.
Irene, do you want to start?
Sure. Well, obviously we need masks. We don't have masks. 1095 masks would be greatly appreciated. We don't have. I've not been given one since this has started. Secondly, we have a big concern and a big scare for caregivers is that we're going to run out of gloves. Gloves is very essential to a caregiver. We are, dealing with a lot of, I don't know the proper word to say for it, but a lot of bodily fluids. And what are we going to do when, not just with the COVID, but there's other things that we can get sick from besides just COVID if we don't even have our basic essentials, which is gloves, shoe covers, Again, and like I said, I've not even been given one mask throughout this. Thank you.
Alicia, do you want to talk about what protective equipment that you think you need the most?
So I'm going to say hand sanitizers, gloves, and masks, yellow gowns, and ventilators. We're running short on all of it. Like I've said before, I'm very fortunate enough after hearing these stories and hearing other stories in other states to have one surgical mask to wear during my shift. So I feel fortunate at this time to even have that, and that's pretty sad.
Thanks, Alicia. I'm going to add this question that just came over chat. Well, so to any of the kind of frontline workers that have been talking, the questions from the Oregonian was just like, what is the role of homemade kind of do-it-yourself PPE? What conditions would you use it? I think that Rick Miller talked about this too, and in what conditions are folks using this, and how much less effective is it than standard PPE? I think that's the question coming in from the Oregonian. So I don't know, I think that Alicia just had to walk away, but Irene or Casey or Melody, if any of you want to take that question.
For myself, working in the grocery stores, we've had coworkers that have made homemade masks simply because we do have customers coming in that are disregarding the 6 feet rule, and for our safety, because they're struggling to get some masks in to help with the employees. So we have employees that are making masks for us to wear. I myself have one that I wear when I do go to work that's been homemade for me.
I was actually just looking for my homemade mask so I could actually show you what we were actually wearing at this time, but I couldn't find it.
Yeah, I would.
Melissa, this is Governor Brown.
Go ahead, Governor.
I just want to, I don't know if Dr. Jacobs wants to talk about what they're doing. They're actually working with Nike to produce face shields. I don't know if he can talk about that, but they've got a direct project they're working on. Oh my gosh.
So Irene and Alicia, just if you guys can just say something so that you come to the front of the screen so that people can see your homemade masks that you just pulled out. There's Alicia's homemade mask. So go ahead and say something really, Irene, go ahead and say something. Yeah.
Can you hear me? Okay.
Mm-hmm.
So my church started making these. I got 10 yesterday. I've got 10 today. On my off time, I've been delivering them to caregivers who take the bus, and then other people I've been having them try to come and get them to me. I'm on my own time. I'm driving to Salem to deliver some to some caregivers because we have nothing. So this is the mask.
Thank you. Alicia, do you want to say something really quick so you come to the front of the screen with your mask?
So this is my homemade mask, but also I'd like to say we're running out of fonts. So we actually have had to now make our own hair fonts to go over our head.
And Dr. Jacobs, do you want to go ahead and talk about what Governor Brown was referring to?
Yes, thank you. I would reference what the governor said earlier. I think, and what we've all been talking about, the best solution would be to make sure that we get protective gear that meets all the existing public health standards. And that's why I think the governor referenced this idea of sure that our local suppliers, people like Nike and others that help us produce this equipment, are not hamstrung or hampered as regards to production of things that meet existing quality standards. So we've been working with Nike around doing just that, so we can stand up capacity as quickly as possible. I would also echo, I think, some of the comments saying that while we urge the federal government to take every action, I think we need to be also looking at local production.
Melissa?
Thank you for that. I'm going to go to the next question. Yeah, go ahead. Go ahead.
Yeah, Melissa, I'd like to just speak very briefly to the homemade mask. supply. I think it is tremendous the amount of community energy that is being put out, and I know that there's a lot of people out there who want to help, and I just want to really urge us not to think of homemade masks as a solution in healthcare settings, especially for frontline workers that are working with COVID-19 patients. They do not substitute for proper PPE. If healthcare workers have to use cloth masks at all, it is absolutely essential that there at very least be a piece of filtering material inside of them and not just rely on the cloth itself, which can actually be more dangerous if it becomes saturated. And that filtering material has to be able to be replaced on a regular basis. It is also the case that the only way in which a cloth mask provides actual protection is when it is coupled with a face shield. So I just want to say that we need to be very careful when we talk about homemade protective equipment and when it can be used in healthcare settings, especially for those healthcare workers actually working directly with COVID-19 patients. In community settings and for non-COVID patients, they can help, and we do appreciate all of the effort that's going into it, but I just want us to be very careful here and to keep pushing the central message, which is our frontline healthcare workers, especially those treating COVID-19 patients, must have medically approved PPE in order to keep them from getting sick, because if they don't, they will get sick, and then their capacity to provide care will be undermined. So let's be clear of what's at stake here.
I appreciate you lifting that up. I do think that these are solutions that workers are having to come up with on their own, because there's not a broader solution to this crisis, and it is not where we want to be. And people are concerned for their own safety and are trying to take this situation in their own hands, but that is not a solution. And that's not what we're here. That's what people are doing. That's what frontline workers are doing all across the board, and it is not a solution to this crisis. So thank you for saying that. I'm next going to call on, we have a lot of questions, so we're going to try to get through them. I'm going to call. Are you unmuted, Blair? Let me see. Okay, I think you're unmuted. Go ahead, Blair.
Can you hear me? Okay.
Yeah,
I have a question for Melody with UFCW. Melody, are you there?
Yes, I'm here.
Okay, great. I was hoping you could talk a little more about safety conditions at Fred Meyer. Like, for example, I'm wondering if you find that you're actually able to keep 6 feet of distance away from yourself and customers and other people. And I'm wondering if you or any of your coworkers have taken steps like separating from your families or other safety measures to help prevent the spread.
Sorry. So customers are not following the 6 feet rule for us. I've seen customers that are coughing on our self-checkouts without covering their face. They're sneezing without covering properly. And so because of that, employees are trying to do the best that they can, you know, with the homemade masks that we have. I have one myself that I wear simply because I do have a compromised immune system, but and so that causes me to, it's me and my husband. I can't go see my grandkids. I can't be around them right now, especially because I do have a grandson that also has a compromised immune system. So I stay away from them for now.
Thank you.
Sorry.
Thank you, Melody. We are getting a bunch of questions, and so we're going to continue to. Next, I got Don McIntosh. Go ahead, Don, you're unmuted. Don, I don't think we can hear you. Can you, might have to, can you try again? Okay, we can't hear you, so we're just gonna go to the next person. I'm gonna go to Ben Bopkin.
Can you hear me?
Yep, I can hear you.
Great. So this question is for members of the congregational delegation. I was hoping you could elaborate just a little bit more on what are some specific concrete steps or actions that you can take to increase the supply of PPE. Is it more of like policy actions on a level where the entire Congress needs to vote, or is it more like picking up the phone call and contacting people?
Congresswoman Bonamici, I know Senator Merkley had to run. Can you take that one?
There are several things that can be done. Many have been mentioned in addition to the funding that was already provided in legislation that has passed. We continue, as Senator Merkley said, to call on the administration to invoke that Defense Production Act. We can work on, as Governor Brown stated, getting the Department of Justice to enforce the price gouging and making sure that those companies that are holding on to that proprietary information are sharing that. And as I mentioned, with our local businesses that want to step up, I am pushing the administration to get that guidance out to our manufacturers. You know, we mentioned Nike, also ADEC in Yamhill County. They make dental equipment. They want to help. Poster Garden in Beaverton, they have high quality fabric and industrial sewing equipment. These businesses want to help and they need that guidance. So we are pushing the administration to get that guidance out about what they need to do to make sure that the PPE they are making here in Oregon meets those standards. So all of those things, we continue to try to get information about when the national stockpile PPE is on its way and how much we can get from there. Again, that hasn't been enough so far, but there shouldn't be any in the national stockpile right now as long as there is such tremendous need. So we will continue fighting on all of those fronts, from the Defense Production Act to working with our local manufacturers to removing barriers to make sure we get this PPE that everyone needs so desperately.
Thank you, Congresswoman. I know that the governor has to leave. I want to thank her for the time. There has been a couple of questions that have come in, Governor, on the chat. One is if we know how many healthcare workers have contracted coronavirus, and one about construction workers and whether they've been donating their PPE. I don't know if Ab, you leave, you have time to answer those two quick questions, but those are two of the questions that have come in.
So I do not have the information regarding healthcare professionals. I've texted Tina Edlin on my team to see if she can provide that information. Dr. Jacobs might also be able to provide that information. In terms of construction workers, I have to say, I would just say the entire Oregon community that has access to protective equipment has been extremely compassionate, generous, and considerate of their fellow Oregonians. And we are incredibly grateful for their donations. I don't have specific numbers in terms of the construction industry. So thank you, Melissa. Thank you to everyone.
Thank you, Governor, for joining us. Thank you very much. Dr. Jacobs, do you have any information on the healthcare question, on the healthcare workers contracting COVID question?
Can you hear me? I can only speak to OHSU. As of this past Sunday, we've had 21 positive COVID-19 cases. 18 were tested at OHSU. 3 tested positive elsewhere and transferred to OHSU for care. So that means as of that date, inpatient emergency room cases 13, outpatient cases 8. 6 of those patients were discharged. Unfortunately, 1 patient died, and we currently have 6 patients in hospital. As regards our staff, as of Sunday, we had 12 staff members who tested positive, 846 tested negative, and we have about 56 tests that are still pending.
Thank you, Dr. Jacobs. I know that frontline staff getting tested is a big issue amongst hospitals, and it's an issue we're dealing with right now in long-term care facilities, making sure that they have access to testing and the testing can come back quickly so that the facilities can respond appropriately. So thank you for that. I'm now going to call on Jonathan from the Portland Business Journal.
Can you hear me? Okay. So this is a question for Dr. Jacobs. Earlier, a contract or an agreement with Nike was alluded to for, I guess, face shields. So I guess two questions. A, do you know if at all Nike has actually produced any face masks to date, or are they still waiting on those federal specs? And B, for the face shields, do you guys have a contract in place? Is there agreed upon price? Are they donating these? What specifics can you outline for that?
Of course, I can't really outline a lot of specifics at this point. I would say we're very proud, pleased that Nike has decided to work with us. You'd have to talk to the Nike folks. Right now, it's at the prototype stage. So we're trying to issue some prototypes, have those tested by frontline workers while we wait on the other issue of whether they meet the appropriate public health standards, which, as you heard, is pretty important, right? We want to make sure that we don't need artificial barriers. The equipment that is provided meets public standards. So my sense is, and thank you to our Nike colleagues, is that given this time of crisis, they're just trying to make this material available. And so the prototypes have face shields, but also masks. And we hope to know a lot more about that this week.
Thank you.
Thank you. I have Josh Shelton.
Can you hear me?
I can, yeah, thank you.
This is for Sarah Laslett. You mentioned that along the coast there were places that were using dirty masks and keeping them in containers. Do you know exactly where along the coast that was happening?
Sarah, did you get that question? Seeing if she's still, she might have had to jump off. I'm
going to say, I'm going to jump in here. We are already doing that at River Bend. The PAs and the doctors have to put their N95s in a paper bag.
And is that
Thank you for that.
3 days of time or the 72 hours that the virus is said to live on those surfaces?
Correct.
Okay, thank you.
This is Kevin Mealy with the Oregon Nurses Association. Sarah Laslett did have to step off, but I think what you heard from Alicia was correct, that we're seeing safety standards and supplies drop across the state and that everyone's scrambling. At Columbia Memorial Hospital in Astoria is where nurses are using Rubbermaid containers to store masks in between patient visits, but paper bags are the other common stopgap. And so you're using the same mask over the course of a 12-hour shift. And so you're carrying the germs from one patient to another, which doesn't work. If you're trying to stop the disease from spreading, there's the danger that you could be encouraging the spread if you're not able to use the masks properly the way they were designed and intended.
And we're gonna close this down. There was last chat question that I think Kevin, you might be the right answer to try to put answer the question if you have the answer, which is protective equipment. Where in Central Oregon is this happening? Is it happening in Central Oregon? And do you know if there's been nurses or how many nurses have tested positive in Central Oregon? So Kevin, you can either follow up with Suzanne offline, or if you have a quick answer, we can do that. But otherwise, we're going to start to wrap up. Kevin,
Yeah, Suzanne, I can follow up offline, but we don't have a number of how many nurses in Central Oregon may have tested positive or may be positive due to the delay in testing. But St. Charles Health System is the largest health system in Central Oregon, and they are definitely seeing a false safe just this week, they have authorized nurses to bring in their own equipment from home due to how low on proper N95 masks and other supplies they've run, which is deeply concerning as we wait for this much needed resupply from the federal government.
Thank you everyone for joining us. This was pretty successful first Zoom press conference about something that is a really serious matter, which is the need to get additional PPE. And I think as we heard from people across the board, we need it for frontline healthcare workers in hospitals, but we also need it across the board for people who are essential workers. If they're essential workers, they need and deserve to have a proper equipment to keep them safe. And that list is long of essential workers. And so if people have additional questions, feel free to email Jay Parasco. It's in the chat, his email address, and he can make sure he's doling out the questions to the different folks on the conference call if they need to have specific answers. We're also going to be sending out a press release where there will be a link to this whole press conference where people can access it. And it will be on the SEIU Local 503 Facebook page. Thank you everyone again for joining us. Thank you for all the workers and the elected officials, the union leaders, and the employers for really coming and telling their stories about this. This is something that we're all united in solving this problem to make sure that workers have the safe equipment they need to be able to take care of our communities. Thank you, everyone.
Thank you.